So extrovert sensing is about basically being reactive and adaptable. So how much does your field require you to be adaptable and reactive to diverse events and unforeseen events too, like being spontaneous and reacting on the spot?
Yeah, I think that's a huge part of what I do. I mean,
Yeah.
there's not a day that goes by either in the office or in the OR that everything goes perfectly as planned. It never, ever, ever happens. And so you absolutely have to have a mental outlook and expectation that things aren't going to go as planned, even if it's minor. And you have to have the capability to react on the fly. And, you know, and I think that requires being an extrovert. I think you have to be a problem. You have to be a problem solver. You have to be able to take stress at every level, even if it's a little bit or a lot on a daily schedule. I think that's a very, very important part of what I do.
And how hard was that for you to adjust to? Like, do you think being reactive and I guess like addressing things as they go was that something you kind of had to work on, or do you think it was something that kind of came fairly natural to you and just had to be more attuned to?
I would probably say that I probably had to work on it. You know, I think I'm very efficient. I get things done fairly quickly. I think I'm very good at decision making quickly. But I do think that I had to work over the years on dealing with frustration and dealing with, you know, things that didn't go exactly as planned, because you're dealing with lots of different types of personalities, every different type of personality in patients and people that you work with. And as a physician, and especially a surgeon in the office or in the OR, basically I'm the president. I'm in charge. And so everybody looks at me that way. And so I've had to learn, you know, how to be a leader and how to, you know, effectively express that in the operating room and in the office so that things get done safely and effectively.
Awesome. Yeah. Another side of that, like besides just being attuned to, you know, spontaneous things and reacting on the spot, another side of sensing is introvert sensing. So while extrovert sensing is about reacting on the spot, being attuned to, you know, different things in reality around you externally, introvert sensing is more focused on what you already know about reality, what's been done, what's routine, what's standardized. So how much of your field requires you to adhere to strict standards and I guess follow a more routine protocol and have a predictable sort of flow?
Again, I think that's also a big part of it. I mean, that's probably more so in the operating room, where there are standards of care and things that you have to be aware of. And you're right, on all those levels, I'm the responsible party. So I need to be aware very quickly if something is not going right, even if it's just internal and I'm just recognizing that something's not going right before everybody else recognizes it.
Yeah.
But I absolutely have to be on top of my game and be aware of those things, both in an introverted sense as well as an extroverted sense, and they play off each other.
Yeah, for sure. And how often do you find yourself having to, I guess, think outside the box from those standards and be more creative when those, you know, when something spontaneous happens and then or something out of the norm and not expected? How often do you have to, I guess, think outside the box, outside of those standards and kind of, I guess, bend and twist what's done to address whatever the problem is?
A good question. I think in my particular specialty, where a lot of what I do is fairly repetitive. You know, a lot of the volume of surgeries I do are very similar. I probably don't have to do that a whole lot. Okay. I'm prepared for it. Okay.
Yeah.
And it does happen sometimes, but I would say the lion's share of what I do is fairly repeatable, and doesn't necessarily require wild swings in my ability to improvise.
Okay. Yeah, because that's basically so that's basically transitioning to the intuition part. Extrovert intuition being about, yeah, you're aware of what's around you, but it's more of an intuitive kind of awareness for the external thing, like improvising, being able to think outside the box for whatever spontaneous thing is thrown at you. So for the most part, though, orthopedics is fairly, I guess, like it's not very common to come across a wild or uncommon case. I mean, of course, everyone encounters like a rare
Right.
case once in a while, but not as it's usually
Not as common, but yeah,
Right,
you
go
probably
ahead.
have to be a little careful there, because probably more in my specific field where I'm doing, repetitive arthroscopic things and joint replacements, that's fairly routine. I mean, you always have to be prepared. But there are other parts of orthopedics, like orthopedic oncology. I would say orthopedic trauma, where things like that happen all the time. But yeah, so there are other parts of my field where things like improvising, and being prepared for even potentially wild or out of the ordinary things is commonplace.
Okay. So another side of that intuitive approach to, being prepared for things outside the norm, that was extrovert intuition. Introvert intuition is kind of similar, but except it's more about narrowing down your possible options to address whatever out of the norm thing is. So it's more, so while extrovert intuition is more about exploring, being outside the box, thinking creatively, introvert intuition is more about narrowing down all those possible creative, other options, being inferring and seeing longer term into the future. So how much does your field require you to make inferences and be able to read between the lines and not go by, what is, but rather what could be for, I guess, more long term, being prepared for long term sort of stuff?
So yeah, that's definitely a part of it. I definitely deal with that aspect of things both in the operating room and in the office, and that is, and ironically, most of what I do is very immediate. If it's broken, I fix it, right?
Right.
I put plates and screws on something, or if there's a tendon torn, I tie it together. I mean, fairly basic in understanding that, but you always have to have an understanding of the long-term effect of what you're doing, right? Because I'm taking care of folks. And a lot of times I may take care of folks for one thing, a broken finger or a torn something, but they may come back to me years later with damage or even potentially another injury. So I do need to be aware and plan for the potential long-term effects of everything that I do.
Right. And how often do you find yourself having to take charge for, I guess, planning for long-term care for patients? Is that really something that orthopedic surgeons are responsible for fairly often, or is it more just, get the job done, do the surgery, yes, be aware of long-term outcomes, but do you ever have to like plan for certain things that the patient needs to do, like long-term?
Well, I probably more so with some of the joint replacement things I do. A lot of the arthroscopic stuff I fix, treat, recover, rehab, and they're over maybe a few months period of time, and then that's it. They're fine and they go on their merry way. With joint replacements, that's a little more long term. I mean, you probably need to see somebody for a year or two, and sometimes longer if there's any complications or. So I do get to deal with both. I'm not necessarily a long-term care provider, obviously. Like I'm not gonna, the things that I won't treat long-term are like rheumatoid arthritis or things that are disease processes. Those are going to be cared for by a primary care physician.
Right. Yeah. Because that's not really orthopedics. That's more rheumatology or something primary care. Yeah.
Exactly.